everyone. It's good to be with you today. As Mr. Shaw mentioned, my name is Carol O'Donnell, and I'm the director of what's called the Smithsonian Science Education Center. And I work in Washington, D.C., which is in the United States. I'm also an educator, and I've been an educator since 1983. So that's 37 years of being in the classroom. Today, you're going to hear from my colleague, Michaela Pavlak. She's an educator too, but she's also an artist. Michaela is a cultural interpreter at the Smithsonian's National Museum of the American Indian and an enrolled member of the Sault Ste. Marie tribe of Chippewa Indians. She graduated from Northern Michigan University in 2016 with a Bachelor's of Fine Arts with a concentration in drawing and painting, and studied a wide range of art history. You're going to do some art today as well. As a creative being, Michaela uses her artwork to educate audiences about Native American culture and the misappropriation of Indigenous cultures. Michaela's goal is to develop a museum in the Upper Peninsula of Michigan in the United States and to use artwork and local Native people's voices to educate others. Today, Michaela is going to show you some of the special objects of art and culture from the Smithsonian's National Museum of the American Indian. Michaela?
Hello, thank you so much. Wow, that was a great introduction. Forgot I had that. Hello, everybody. My name is Michaela. As you mentioned, I am a Anishinaabe or Ojibwe from Michigan. I'm a citizen of the Sault Ste. Marie tribe of Chippewa Indians, and that is my nation. We are located in the Great Lakes region of North America. And I am calling you from Washington, D.C., the United States capital. And I am, a cultural interpreter, which means I'm an educator. And I would like to show you just a little bit about our museum, the National Museum of the American Indian in Washington, D.C. So here is our beautiful building. This is the museum on the National Mall. I just want to show you a little bit of where I'm visiting from. So this is a beautiful place where we get to work, and this museum actually represents Native communities of the entire Western Hemisphere. So not just Native Americans in the United States, but of North America, South America, and Central America. There's over 2,000 communities. And today, I'm going to share a little bit about my own culture and community through the 7 grandfather teachings. So the 7 grandfather teachings in Ojibwe culture has been traditionally passed down through, elders telling stories, teaching lodges, but it's passed down generation to generation. And today I'm going to share just a few elements about these really important values that help us really center ourselves and help us create a balance between our physical, mental, emotional, and spiritual health. So the stories of the origins of the 7 grandfather teachings can be seen in multiple Anishinaabe or Ojibwe communities, and they can vary depending on where they are located. Again, being from the Great Lakes region, these are 2 examples of how we view our teachings. So despite where the teachings may have originated, they have the same concepts of, abiding by this moral respect for all living things. So we follow these 7 teachings. So follow along with me. We have humility, bravery, honesty, respect, truth, love, and wisdom. So within those 7 teachings, we will look to an animal and to nature to really listen and follow the values of that animal. So for example, on the left, you can see truth. And these are actually 2 of my art pieces that I did about the 7 teachings. So this is contemporary art, and this is how I interpret the 7 teachings. So the truth is saying, be faithful to reality. So the truth is represented by a turtle, as he was there during the creation of Earth and carries the teachings of life on his back. But the way that we can see it and follow the turtle is, it's a slow moving creature. And he moves so slowly because he understands the importance of both the journey and destination. And so understanding truth is, understanding your place in this life and apply that understanding to the way that you carry yourself. So this means be true to yourself in all other things. This is something that I see in all ages, no matter how old you are. You have truth in you. And again, it's the way of being faithful to yourself and trusting the process. And then we have the wolf with humility, which says treat all life equally. And so this is represented by the wolf because as wolves follow in a pack, that's what their life is dedicated to. So if we think about it in our own lives, we're dedicated to our family and to our communities. And so this is really understanding and respecting our place and the way that we carry our pride with our people. And we praise the accomplishments of all. So we kind of find this balance within ourselves and all living things. So we respect how we treat ourselves and other people, but also the environment and the way that we can really see that we are all equal. So another way that, we kind of learn this is how we can stay connected. If sometimes I feel lost, if I'm feeling down, I might turn to these principles. And I might be a little bit kinder to myself or to other people because I understand humility. So this is something that you can carry, and that this really varies across Indigenous communities. These stories have a lot of power. And I also want to share a little bit about, art and what that means to our people. So these are paintings, but Native peoples actually can share their beliefs, their understanding through many ways, through many art forms. So I want to show you just one example of this beautiful collection piece that we have in our museum, which is actually in New York. So we have a sister museum that we share this with, and this is a Birch Bark house. And this is a way that we can share our contemporary homes because our homes did not always look like this. There are wigwams which are made from birch bark. So I just want to show you a little bit about what birch bark looks like. So I have this piece right here, just so you can see it a little bit better. So this is the birch bark, and this is how we can continue to express and honor our traditions, but make contemporary items. And another thing is we turn to nature for medicine, and medicine in many ways. So another thing is this sweetgrass. So sweetgrass smells amazing, and it can be medicine by the way that we burn it, or the way that's in a circle right now, it's protecting me. Now I want to show you a piece that my aunt made, and it might look familiar. This is a turtle, and this is made from sweetgrass. So remember, our turtle is representing truth. So sometimes I might look to this turtle. He's made of medicine, but he can continue to teach me how to be truthful to society. And these stories are told continuously through generations. And I'm so happy to share that with you today and connecting yourself to some of our own values and maybe adding a few of Anishinaabe or Ojibwe values to your core values. So that's all I wanted to share a little bit, but now I want to bring Carol back into the conversation.
Mr. Shaw, you have a few questions?
Yeah, we do actually. So if you're okay, Michaela, I've got some questions coming in to you now. These have been sent in to us, which we really appreciate. And please do keep emailing in a question on that side of it. You can log in via Teams. The first question I've got here is from Carmen from Madrid. It says up here, interesting question. We hear a lot about fake news and also historical inaccuracies. How can we make sure the role of Americans is represented truthfully?
That is an amazing question. Caught me off because I could really ramble about this, but I really appreciate that you were thinking about that, about including Indigenous perspective. One way that people can support Indigenous stories and history is to listen. To listen and include Indigenous voices in the narrative. So a lot of times that was missing in, especially in American history, a lot of that was missing. So now we're working more so to add Native perspective. So that's part of our museums. Our mission and our vision is to empower those Indigenous communities. And how we do that is with our allies. So people like you all the way over in Madrid, you're thinking about Indigenous perspective. And a huge part of that is listening and giving space for Indigenous peoples to share their values. So we have a program coming up. Yeah, we have a Youth in Action program coming up in December that's going to talk about that and how we change that narrative.
Okay, I mean, I'm really quite impressed by somebody in Madrid thinking about that and going through that. So thank you for that question. It's quite a deep one. And now the next question is a bit more close to home from you, because somebody called Andrew, actually in Michigan, has sent a question in there. Now, I know you don't know the Andrew from Michigan at all, but the question was, what do I need to do to become a cultural interpreter?
Oh, man. I love that. And I was joking earlier, this is not my relative. I don't know this person. But as I mentioned, this is an education role. And my background is in art, in history. So there's really so many ways to get involved, to be a cultural interpreter or an educator, and it can happen at any level. I think that's really important. You know, of course, to get into the Smithsonian, you can join internships, you can write in. I think it really starts at home, in your own community, to be an educator, because really that's what we are, and that's what we want to continue to share. You know, so way up in Michigan, you can be an interpreter and sharing your stories and educating people.
That's brilliant. Hopefully inspirational. And you never know, Andrew, if you do go on that path, do let us know, and we can sort of share that across at the same time. You may even meet Andrew at some point in Michigan, but it is a big place, Michigan as well. The next one's a bit further away from you, from, I think I pronounced it correctly, Toulon. So Toulon's in Sweden, and says, I'd like to study more about the culture of Native Americans. I think Toulon is somebody who's very much into art, and wants to perhaps integrate that into the artwork, especially the art side of it. Where do you think I can learn more about this, and particularly the techniques they use in art?
Oh, wow. There are a ton of resources. Of course, on our website at americanindian.si.edu, you can learn more about Native nations. Another really great thing is that you can look up tribal nations and their own websites, and they do talk a lot about their history. So for example, I have my own nation's website. It's siouxtribe.com. But if you're interested in the Southwest, like the Navajo and the weaving and the artwork or pottery with the Hopi, they have their own websites too. And you can learn directly from that nation or community.
Amazing. So again, you know, I think there's a lot to learn from here, and I know that it's connecting to our generations, to our ancestors, the stories, the arts, the craft, the artwork can really inspire what we go forward. Some great set of questions. Thank you for sharing a bit about your life, Michaela, as well, and you know, your own beliefs and what you've shared. That I love what you brought with you know, the image there of how we use techniques to craft different things as well. It's beautiful, very personal to you, and I fully recommend going to those websites you mentioned as well and taking part in that. A great thing to go and do. Thank you very much. I think I'm handing back to Carol now, who's going to introduce our next guest. Carol, are you still with us?
Yes, absolutely. Thank you so much, Michaela. I want to echo Mr. Shaw's comments. That was wonderful. And I loved the questions, of course, that the students asked from all around the world. At the Smithsonian, as you noted, we care deeply about helping young children learn through objects in our collection that you shared, artwork like that you shared, museum exhibits, education, science, and of course, cultural experts like Michaela. So thank you, Michaela. And now I want to introduce Dr. Megan Collins. Dr. Collins is a medical doctor at the Johns Hopkins Hospital in Baltimore, Maryland, in the United States. She is a pediatric ophthalmologist. This means that she's a doctor who specializes in treating eye conditions in children. She's also an educator, but instead of teaching young children like you, she teaches adults at the Johns Hopkins Berman Institute of Bioethics and the Johns Hopkins School of Medicine. Dr. Collins' research interests include the doctor-patient relationship, public health ethics, and barriers and access to pediatric eye care. Dr. Collins is also a co-director of Johns Hopkins Consortium for School-Based Health Solutions. You know, at the start of the COVID-19 pandemic, Dr. Collins and her colleagues developed an online curriculum to teach kids about the virus that causes COVID-19, turning them into advocates as a way to stop the spread. Students can learn about the biology of the virus, why you wear a face mask, and why the virus can spread in people who have no symptoms. And the best part about it is that the curriculum is completely free and something you can use in your community. Welcome, Dr. Collins.
Thank you, Carol, for that lovely introduction. Hello from Baltimore, Maryland, where we have just passed the noon hour. It's a pleasure to be here today.
Hi, Megan. So,
Hello, Mr. Shaw.
no problem at all. Can you still hear me okay? Is that all right?
I can, absolutely.
Great. So, from our point of view, we have lots of guests in the global classroom, and you're sat there in a white coat. Wonderful shot there as well. We've heard what you do. Talk us a bit, first of all, about your day-to-day job and what it actually means, and what is it like right now in the pandemic as well?
Sure. So I'm a pediatric eye doctor, and as Carol mentioned, I work at Johns Hopkins, what's called the Wilmer Eye Institute, which is our ophthalmology department. And my job is really sort of divided into a couple different areas. I see patients every week, and I see patients who come into my clinic from the outpatient setting, so that they come in to see me in clinic and then they go home. I also operate on patients. Sometimes they need to stay in the hospital after surgery, and sometimes they go home right afterwards. And mostly what I operate on is sometimes people have an eye problem where an eye will drift inwards towards their nose or outwards, and it may cause them to have double vision. And I do surgery to correct conditions like that. I also, one of the favorite parts of my job is I get to see the babies in the neonatal nursery who are born prematurely, because sometimes they can have an eye condition that impacts their eyes. And so I screen them there. But I also, as Carol mentioned, I'm an educator. I'm the daughter of a teacher, and I help teach both our medical students as well as our ophthalmology residents and fellows about the eyes, and about my other interests, which are largely about public health and education, and how do we do outreach through programs like our new Hopkins Health Education and Training Corps, where we're trying to connect with millions of students across the world who've been impacted by COVID this past spring and this school year, closing their schools, and they've got lots of questions. So we're trying to help answer them.
I think what you mentioned there, you touched on the idea of education for COVID-19 and the understanding for children. Can you talk a bit about the work you've done in trying to make sure that we all understand how to sort of stay safe in the pandemic, and also understand the virus as well, and how we can access that, perhaps the young people watching it right now?
Absolutely. So, I can speak personally about what happened in Maryland. It was March 13th that schools across the state closed. And it was because, states across the US were starting to go into lockdown phase, and we followed. This was happening in Asia, it happened in Europe and other parts of the world. And all of a sudden, kids who had been going to school every day, seeing their friends, playing sports, worrying about their math tests, all of a sudden their schools were closed and they were home. And as a young person, that must have been incredibly stressful, because sort of their normal, ordinary day-to-day activities had been suspended. At the same time, I think all of us were being inundated with news coverage about, case counts and numbers going up, and people needing to wear masks and socially distance from each other. We have a lot of people who were personally affected from somebody in their home becoming sick, sometimes somebody in their home losing their lives. And we knew that kids wanted information about COVID, and they wanted somebody to explain it to them. And a lot of the early public health campaigns were towards adults, grown-ups saying, you know, this is what you should do when you go out, but it wasn't necessarily geared towards young people. So our team here, really under the leadership of one of my colleagues, Dr. Panagis Galadiasatos, we call him Dr. G for short, you know, we said, let's try to develop education for kids and tell them what is the virus and what does it mean and what is coronavirus and what's the biology behind it, and put it into a framework that was understandable for them, but also empowered them to be able to do something about it. So be able to learn, how do you make your own face mask? How do you talk to your friends and your family about keeping yourself safe during the pandemic? And we've launched this both locally in Baltimore as well as in school districts across the US and across the world now, with a great response. Kids get it more than adults a lot of times, and they're excited by this knowledge and they're incredibly curious. And one of the really unique things we do with this curriculum is it's not only that we have, you know, we have slides and lectures where we teach the content to people, but we try to make it really interactive, and everything is communicated with Hopkins health educators who are either physicians or nurses or graduate professional students in public health or education or medicine. So we can connect with students across the world, and they can get to learn more about the healthcare profession as well.
That sounds amazing in what you're doing there as well. In terms of that whole process of getting the knowledge down to an acceptable level for the children to access that, was there anything that surprised you with that at all? Anything that came out like, wow, that was interesting, I didn't expect that, or stand-out moments for you particularly?
I am, you know, I first started thinking about it. We did a lot of community engagement calls at the beginning of the pandemic. I think Hopkins as an institution was very committed to local outreach within Baltimore and making sure that we were checking on the well-being and needs in our community. And we would have these community engagement calls, sometimes with adults and sometimes with kids. And, you know, all of us who work on this teaching core were part of that early group, and we were struck by the sophistication of questions that kids would ask, but also sort of heart-wrenching questions that kids would ask, like, is somebody in my family going to die from this? And is it okay for me to hug my grandmother? And it really drove it home for us how many questions kids have and how scared they might be right now, and how important it is to empower them. I mean, they are really the ones who have been disproportionately impacted in ways that just unprecedented. So what the other thing that has been surprising and we've really enjoyed is everywhere we've done this curriculum so far, the kids have been amazing, the teachers have been amazing, but the kids have really wanted to take this to the next level. And it's not just, okay, I want to hear about COVID and then we'll go on with my life. They want to learn about it so that they can do something about it. So it's not only just teach me about this, it's teach me about this so I can figure out action plans and things that I can do within my school, within my family, within my community. And seeing kids have that sort of motivation and interest has just been incredibly inspiring.
That's really impressive. I think you're right. That passion, that desire to learn for young people, the inquiring mind shouldn't be limited. Go on. What do you want to learn? What's next? What's next behind that? Now, you know, we've had a few questions sent in. Doctors in the house right now for the global classroom. So we've got some questions for you. The first question I want to put to you from outside of here, that one comes from Austin right here in the UK. And I think I'm going to plug him in now and hopefully hear that question. It's a very precise question about a medical condition, which I think you're pretty good at on that side of it. So Austin, hopefully you're here somewhere. Let's hear what you have to say.
Hello.
Hi, Austin.
Plagiocephaly as a child. Had it not been corrected, would it have affected my eyesight?
Hi, Austin. I'm not sure, Mr. Shaw. I think he said he'd had plagiocephaly as a child.
Yes, I'm plagiocephaly. I can just about get it right. It's a complicated word, and I know it's. Thank you for that. I know it's one that you understand very, very well, and obviously a condition there. So perhaps you can answer that question for Austin.
No, it's a great question, and so yes, so plagiocephaly, literally, it's sort of a medical term that means a flattened part of your skull. the skull, that sits under the skin on the scalp of your head. And it can happen for a couple different reasons. It usually happens, just as babies are born, because the bones of their skull are still growing and forming, so they can be soft. So if you would lie on one side for months at a time, which can sometimes happen with babies born really early, they can actually get kind of a flat area on their skull. There are treatments for that, including some types of physical therapy and actually helmets for babies. What Austin might be talking about is there's another type of, and again, it's plagiocephaly, and there's a type where you can be born and the bones of your skull have closed in an abnormal way. And that type of plagiocephaly can sometimes can sometimes be part of a syndrome, which is a collection of different findings, and sometimes that impacts the eye. So if it does, there are different treatments, but it sounds like in Austin's case, he was treated early. So.
Perfect. Thank you for that as well.
You're welcome. Great question.
Then the next question could be a difficult one, but hopefully not too bad. Came in from South America, from Deanne. And they were asking here, do you think we'll ever get rid of COVID-19? I think they're getting fed up of it at the moment, and they're saying, will we ever actually get rid of this?
That's a great question, and one I think all of us are asking every single day now. In the U.S. news, certainly there's been a lot of coverage in the past week about 2 promising vaccines that have come out through both Pfizer and Moderna, and I think that's giving people a lot of hope that we're going to get to the point within the next 12 months that we're going to have vaccines that are going to be deployed to large percentages of the population. And I think there are other vaccine trials and other vaccines that are developing around the world. Will we? So a vaccine is clearly going to get us to a solution. I would say one of the things, the silver lining of COVID to me, is that it has reinforced for us all of these important things that we should be doing anyway. Hand washing, lots of good hygiene when you are touching doorknobs and elevator buttons and things like that. But it also has, through things like our teaching core, I think inspired probably a whole generation, including many of the people listening to us today, to think about careers in public health and medicine. And the world needs that. And so hopefully we will continue to inspire more people who have been impacted one way or another through this pandemic, that they can help ensure that something like this doesn't happen again.
A wonderful answer. Thank you very much for that. So much about the silver lining and the hope coming out of it as well. I think on our time slot, we're running out of time right now, but I've got to say, Megan, thank you very much for coming in. Amazing. I would encourage the message there that came out about have an inquiring mind. Seek out the resources, go and look for it, understand it yourself. And Megan, I know you've got a busy day. You're actually in the hospital right now, so have a terrific time and please enjoy. But thank you for joining us here in the Global Classroom as well.
It's my pleasure. And Mr. Shah, I should just say the email address if people are interested in learning more about this curriculum. Let me just spell it out. It's heatcorps.jhu.edu. That's heatcorps@jhu.edu.